Hi, everyone. My name is Gary. In case you don't know me, I am a respiratory therapist, respiratory care practitioner in Los Angeles, California. And I am starting this new series where I focus on other healthcare professionals and showcase them and their job. And hopefully that can help you along your journey. Today, I have the honor of speaking to AJ. He is an awesome ICU nurse. So you've been a nurse for about a year now, right?
More like a year and a half by
Oh,
now. I want to say 18, 19 months.
nice. That's
Mm.
exciting. Okay, so introduce yourself and tell everyone a little bit about you.
Yeah, so I've been an ICU nurse. I graduated in May of 2019, started working in August of 2019, straight into the ICU. I'm over here in New Jersey, so we have a 3 hour time difference. Um, and yeah, I'm living home right now, trying to save as much money as I can. And yeah, that's really it.
So we actually kind of started around the same time. I also graduated in June of 2019 and then took my boards and then got
Mhm,
hired and have been working since. So we're both like a year and a half-ish.
mhm.
So I also I work at two facilities. I work at a bigger medical center, and then I work at a decently sized, like I would say it's pretty big for a community hospital. You also work at a community hospital, right?
Yeah.
Do you feel like it was easier for you to get into the ICU as like a community hospital ICU nurse? Because I know at my bigger medical center, I've talked to the nurses and they can't just transition or train into the ICU. You have to get like hired into the ICU.
I think it was definitely easier to start off there and then, learn the skills in the community setting.
Hmm.
I do know I have a lot of friends who go directly into the ICU into like really big medical centers
Hmm.
and they're doing just fine. But,
That's good.
there is like the 1 year in med surge or 1 year previous experience or 2 years, and then you can get trained into the ICU. But I feel like in the community setting, I have a lot more freedom when it
Hmm.
comes to, different devices that come or different kinds of patients because it's a general ICU. So, we get the most critical patients in the entire hospital.
Yeah.
I mean, it's a community hospital, but we get a fair share of different patients.
That's exciting. I know like some of my friends at my community hospital just started out too in the ICU.
Mhm.
Like they recently just got trained. And I just think it's like so cool and exciting to see them like transition and grow as a nurse, you know? Um, I personally like love the ICU. So I think, I don't know, I just love the ICU. So I think the ICU is super exciting.
I love it too, but I'm not biased or anything.
So, is there anything at your hospital that you guys maybe don't do that some bigger hospitals do in the ICU?
Oh, we I feel like my coworkers and I talk about that a lot.
Mm,
Probably ECMO might be one of
mm.
the biggest things. It's not like we're a level like a level one trauma.
Yeah.
Sometimes I feel like we don't always have really critical assignments. I'm not like always having the sickest of the sickest patients on the unit, and sometimes that could be good for my workflow and for my mental health and making sure I'm not too stressed all the time.
Yeah.
Part of me's like thinking that there's a lot more out there that we could do,
Hmm.
um, you know, patient population wise and disease processes and stuff like that.
Hmm. Yeah, that's how like I felt at my very first hospital. It was a super small community hospital
Mhm,
and it was a lower income community
mhm.
and the hospital's budget wasn't that big and so our equipment was outdated and I just felt like there's so much more I could be doing as an RT. So thankfully at my other community hospital now it's much more advanced. It's not like crazy like
Mhm.
big or anything. It's still just a community hospital. We're not a trauma center or anything. But Yeah, so I know that feeling of like wanting to do more, but it seems like your hospital's like still pretty good though.
Yeah, yeah.
That's good. So what's the scariest part of a code for you? Because I feel like for nurses, it must be so intimidating because not only, like, especially if it's your patient, not only do you have to like kind of know everything about this patient, the doctor is asking you all these questions like about labs, oh, what was their previous this and that. And like, so what's your role in a code and what's the
Mhm.
scariest part of a code for you?
You know, I've had a fair share of my own patients coding, and the very first time that happened, like I was I was like shaking after it, because I
Yeah.
didn't expect it, first of all, and it was out of nowhere. It was out of nowhere. It's probably best when someone else's patient codes and I go into that room.
Hmm.
I feel like my role, I really like the code card. I really like the code card. I like getting the medications together, mixing them,
Yeah.
handing it to them.
Mhm.
The other role that I like is recording during a code. I know a lot of people don't like that, or they're scared because they don't want to be sued because they're signing their name at the
Yeah.
bottom. But in the ICU, organization is like a big, I feel like that's a lot of character traits, or that's a main character trait for a lot of ICU nurses, like being really organized and being very particular about how their room is, how their lines are,
Yeah.
for assessments or charting. And for me, being able to have a really organized code and make sure everything is done on time, reminding the code leader when, pulse checks, meds are due, do we shock, looking at the entire situation. Um, I know it makes it, knowing that I have my eyes everywhere and I'm listening to everything and
Mhm.
nudging everyone in the right direction, uh, is probably my favorite part about that. But I still get nervous, but when you do have a good team around, and I do
Yeah.
love, my coworkers,
Mhm.
that things go really smoothly.
Oh my gosh, having like such a good team, a good group of coworkers around, especially like when you're working a shift and you're like, oh, thank God, like this
Yeah.
person's here and this person's here, like, because you just know, like, no matter what happens, everyone's gonna have your back. And that's like the best feeling. I feel like that's what I love most about community hospitals,
Mhm.
especially, is there's such a community vibe. Whereas like some bigger hospitals, it's kind of harder to find people and I don't know, you're kind of just a little more on your own. So there's
Yeah.
like pros and cons.
No, I feel like my coworkers have definitely helped me in the transition from a new grad. Finding a group of friends and a group of people where, I feel really supported.
Yeah,
Yeah, that goes a long way.
that's awesome. Um, so how is like your relationship with RTs at your hospital? Because I feel like at some hospitals, like nurses and RTs just don't really get along.
Hmm.
And I feel like at other hospitals, like RTs are really respected. And so how is it at your facility,
Yeah.
in all
Um,
honesty?
some RTs do follow me on Instagram, but I'm still keeping it real. Um, I, I do really love the RTs at my facility. Starting off with a good relationship in the beginning, I feel like has been key for me in maintaining that relationship and making sure that my patients are well taken care of and the unit is well taken care of. I'm able to easily reach out to the RTs, and if I need something, they're there, and they support me. Sometimes it's not always the same for other coworkers,
Yeah.
I will have to say, but I'm able to work hand in hand with the other RTs. I let them know if I make any changes. I don't know if if you're a stickler for that. Um, but like, if breathing treatments have to be done,
Mhm.
uh, because usually it's like the RTs do the breathing treatments. I know in
Mhm.
other facilities, nurses do the breathing treatments, but if they're busy or if I'm pressed for time, we're able to be really, flexible with me giving treatments, me putting on the BiPAP, them putting on the BiPAP, and to make sure everyone's not too overloaded.
Yeah, I love that. I love like, so with vent changes,
Hmm.
it really like depends. Like if it's like an FiO2 change, like that's fine. Especially as I think like no matter what you're doing, as long as you're communicating, like it's fine. But sometimes there are times where like you go and you see the vent and like the rate is changed. And the nurse
Oh,
is like,
yeah.
oh yeah, I changed the rate. I figured you were busy or something. But like when you change one parameter, you have to change another parameter. You can't just
Mm,
like change the rate, you know, because then the patient might be flow starved. And then like,
mm,
it's like a domino effect. So there are some nurses at my big facility that do make some changes without even letting us know, which is super annoying. Because yeah, sometimes I have like 20 or more patients, you know,
mhm,
so it's like if you call and ask me, I'm totally okay with it. I love when my nurses like help with the BiPAPs when they can put them on, take them off. I love when they give like right now with COVID, we have a lot of MDI, like inhalers.
mhm.
And I love when I'm like on my like 10th patient and I'm checking on the computer while I'm charting for this patient. I'm checking and then like the nurse gave the MDI in this other room. I'm like, oh thank God. Like it's like one less thing that I have to do and I appreciate it so much. And I always let them know, like, thank you so much. Like I was so busy, you know? So I love when my nurses help, especially when they like can help troubleshoot like,
Mhm.
hey, like the patient's desatting. I did this, this, and this. It's still not working. Like, I love that. You know, like when
Yeah,
you guys like,
working with vents and being able to, troubleshoot. I love troubleshooting. I love like thinking about, is it the patient? Is it the ventilator?
yeah, me too.
I really only do FiO2 titration. I don't touch it, anything else.
Okay,
That's
that's
foreign to me. IDE, like, um, yeah, that's really it.
yeah, I had this one nurse who was like, yeah, this RT got mad at me because I was like changing the rate, but like the doctor put the order in. I'm thinking like, yeah, wouldn't you get mad if I changed your pump and like adjusted it? Like,
That's a
hello,
good
like
point. Yeah, yeah.
you know, the only thing I do on the pump is like silence it and then I say, "Oh, your pump was going off," you know? Like but that's it. I don't like do I don't know. I don't increase the dosage or anything.
Hmm. Hmm.
Okay, I have such respect for nurses. They have to know so much stuff about like different medications. You have to know so many different things about like the anatomy, where like with RT it's more
Hmm.
specialized. And so I honestly don't know how you guys do it all. Like, and on top of that, you're like caring for the patient, doing everything for them and doing all these different meds and just like trying to stabilize them. Um, but yeah, so if the doctors are rounding and everyone's asking you questions, or if it's a code, like how we kind of talked about earlier, is that hard for you to try and almost remember everything about that patient and like what they're getting and how they've been and also you have to know like how they were the previous shift
Hmm.
and yeah, is that hard? I feel like it would be hard.
It is hard if you don't know, obviously. But what I try to do at change of shift is I go through the most recent notes
Mhm.
that everyone on the team has said during that previous shift.
Mm.
I try to find, why are they here? Sometimes reports like not good.
Yeah.
You
Yeah.
get a bad report and you're like, okay, I know they're in this room and they're full code
Yeah.
at the end of the
Exactly.
report. That's all you know. So I always double check my labs and the notes from the intensivist, and any other consults that they have, just to make sure I have a good foundation. I have my report sheet with me at all times, hopefully,
Yeah.
and that hopefully, and then within like 2 hours, I can figure out what needs or what the patient needs
Mhm.
that I can advocate for the patient when they do the rounds
Yeah, it's
eventually.
so hard when you get like honestly a bad report. Like it's just, you know, like if there's like a code or a rapid and then I find out like, oh, this patient had like a lung transplant last week, you know, or like they were intubated like 3 days ago, like that would have been nice to know. Like,
Mhm.
yeah, reports everything. So I'm such a note looker too. But like I said, you know, sometimes we have like 10, 20, 25 patients, it's hard to know everything about everyone. So yeah, a really good report is really important. So your mom's a NICU nurse.
Yeah.
And so tell me about her a bit and how inspiring that was for you. Was that like your main inspiration to become a nurse? Was the nursing school easier because of that? Yeah, so tell me a little bit about her.
She came here from the Philippines in the 80s. I think she did some like health job over in the Philippines and decided to do nursing because of her aunt, my like grandmother,
Mm,
my grandmother.
mm,
Um, and so she's been a NICU nurse for like 20, 30 some years now.
that's awesome.
And the funny thing is, like, I have a lot of Filipino family, and a lot of them are very medically focused. Like, they're
Mm.
either a PT, a doctor, or a nurse. Um, but the funny thing is that none of them really pushed me into nursing.
Oh, good.
Yeah, it might have been like the social pressure, or maybe it's like, oh, that's all I'm surrounded by, so I'm gonna do
Mm,
it. A
yeah.
lot of my friends were doing that too.
Mm.
Um, so, when I told my mom that I was applying for nursing, she was like, "What? Like, why aren't you like just go be a doctor?" And like a typical,
Yeah.
typical Filipino mother, why not be a doctor? Like,
Yeah.
I don't want to drown in debt. I don't want to,
Yeah.
XYZ be in school for so long. And I feel like
Mm.
financially, it was more like financially and realistically,
Yeah.
nursing is where I fell.
Mm.
It wasn't like someone told me to go into nursing. Um, but yeah, my mom still works as a NICU nurse, and she always talks about the different kind of babies that they have over there.
Mm.
Sometimes she'll be like transporting to like a bigger center,
Uh,
like CHOP or something like that.
nice.
Yeah.
Do you guys like go back and forth about like, I don't know, like did you ever like be like, Mom, is this medication does this, right? Or like, did you ever ping pong ideas with her or
Yeah, not really. I feel like she'll ask me, especially when I was studying for the boards,
Mhm.
she'd be like, "Okay, quiz me." And I'm like, you deal with like
She deals with
tiny
like
babies, like
babies? Yeah, it's like
babies.
different.
And I'm like giving her, all right, tell me what, this med does, and it's a vasopressor. And she's like, "Oh, I don't know what that is."
I know that's like going into people always ask me like, do you want to do peds? Do you want to do NICU? And I'm like, maybe peds, but like I'm just so used to adult care and adult vitals and adult med
Yeah.
dosages. It's just a different world. It's like you really do have to kind of relearn everything. Um, but yeah, so I understand how different it can be. My grandma's an RT and she's not anymore, she's retired, but I guess I didn't really like I didn't really ask her for like help during my testing or anything. Like we would talk about things. I'd be like, "Oh, I did this today," or "I learned this," and we would like kind of share experiences. But I guess I never really like asked her like a test question or anything, or to like help me study.
Hmm.
But yeah, also like she didn't really push me to be an RT.
Hmm.
I was just kind of like looking into different professions. And then, of course, the college I was at had nursing. So that was the first thing I looked into. And I was reading the description and I was like, no, I don't want to do that. It's like, no. And then, so I was just like, what else could I do? And I've just
Hmm.
always had like an interest in the medical field. And I was just like looking up other stuff and I was like, duh, like, why didn't I think of respiratory? Like, my grandma's an RT, you know? So that was kind of, I just, I don't know. Maybe it was somewhere in the back of my head, but I never like really thought to do it.
Was
But here I
was
am
RT
now.
your first degree, or did you have something else before? Were doing
It,
something else before?
I was a film major, so I was going to school for film
Mm-hmm.
actually. So like
Wow,
completely different. Yeah. I
didn't know
didn't
that.
have any like prereqs started like but okay, back to you. What advice do you have for nursing students right now who are struggling in their program? I get a lot of like questions like I don't know if I can do this. I feel like I'm struggling. Like, I don't know if I'm going to understand all of this. And I feel like with nursing, it's probably even harder because you guys have so many more like
Mhm.
meds and diseases and things to go through. And, your schooling's a little longer. What advice do you have for struggling nursing students right now?
When you ask that question, I think about, all the moments every day that I struggled in nursing school.
Yeah.
What really got me through was the group of friends that I had,
Hmm.
having study groups,
Hmm.
that went a long way. Eventually, I ended up being more of like a solo studier. Um, and a technique that I used to I used to do as a student was like always testing myself and creating questions for myself. And that's like active recall.
Yeah.
And I feel like that's how I studied for my NCLEX. That's how I'm studying for my certification exam right now. And I feel like that's how things are sticking for me. And that was, how it worked for me, worked best for me. It works different for other people.
That's like literally exactly what I did. Like,
Yeah, yeah.
I think finding a core group of friends in your program, like at first I started out and I was like, who am I going to be friends with in here, But then you find your people and then you stick with them and then you
Hmm.
share your struggles and you realize like you're not the only one struggling. This isn't hard just for you. I feel like when you're by yourself, you can kind of like bury yourself in your thoughts and your emotions when really like everyone in the program's going through the same thing. But yeah, I would like try study groups, but at the end of the day, it was all about like me quizzing myself and me
Hmm.
rewriting questions. And yeah, I feel like we had the same study techniques.
Yeah. And knowing, yeah, what you said about we're all going through the same thing,
Mhm.
and not being too, what is it, like inward on yourself and really hard on yourself because
Mhm.
there are a bunch of other people in your cohort who are going through the exact same thing.
Yeah, I think it's really easy to get like trapped in your own emotions. But then next thing you know, like if you just stick with it, like you just have to not give up. Like no
Hmm.
matter how hard it gets, you just have to not give up and just read. I feel like it's really hard, like when I don't know, like if we were going over like a disease and it just seemed like,
Hmm.
how am I gonna know everything? It's like just start, like just start. You really just
Yeah.
have to like do it.
It's like when you're trying to clean up a really messy room, you're like
Yeah,
overwhelmed by the mess and you don't start, but you have to start somewhere at some corner, pick something up, and then step away and then come back at it and not be
exactly.
overwhelmed with like the big picture. Take little
That's
bites.
that's such a good like metaphor.
I the reason I say it is because my
Because your
room
room's a mess.
outside of this window is very messy.
Let me see your floor really
No.
quick. Oh my gosh, that's so funny. No, that's really good. That's like exactly how it is. You just have to do it. And I would like take my breaks, I would read a chapter and then I would watch a Netflix show and then I would go
Mhm.
back to it. Um, you can't, I don't know. Some people can study for hours and hours, but I feel like at that point your brain just becomes mush.
Yeah, yeah.
Okay, so how can kind of piggybacking off of that, how can someone tell if like nursing's right for them? People always ask me like, should I do nursing? Should I do respiratory? I don't know which one I'm calling, like which one's calling me. How did you know nursing was for you?
That's a tough question to answer.
Yeah.
I could give like the political answer, or you know when you know. Sometimes you don't know. You graduate and you still don't know. And there are people
Yeah.
who I've ran into. What is it? People in my cohort who are still like, I don't know if nursing is right for me. Maybe I should go, you know, become a PA or like go into graduate school and stuff like that.
Hmm.
What I can say from my perspective is that I went into nursing uh, because I liked the medical field. I liked how it felt to give back to someone, something like making tangible, real, in time change, or
Hmm.
and in my clinical rotations and the simulation labs, that's kind of where it kind of solidified for me that I wanted to continue with this.
Yeah.
Sometimes you don't know until you're in it.
Yeah.
but then you get caught up and you're like a lot of what ifs. And for
Mhm.
me, I try to, you know, there's always a lot of what ifs, but I'm always trying to look forward
Yeah,
instead of thinking about what could have been.
that's really good. Yeah. And I always tell people too, like I love when people ask me questions, like especially like at the hospital, if a nurse is like, what does this mean on the vent? Like I love to teach people. And so I think one of the things to remember too is like not everybody knows everything,
Mhm.
and everybody's asking questions, like everybody's asking for help. Um, and it's just like a constant learning experience. So to like, I think just people have to try not to be so hard on themselves, and like you really don't have to know everything, you know. Everything's gonna like kind of come as it comes with more experience, and that's kind of all it takes. And also, who for those who may be like in the field right now unsure if this is for you,
Mhm.
I would suggest like trying a different hospital,
Yeah.
because I think that makes a really big difference. And then also maybe trying a different unit or like a different aspect with nursing and with respiratory. Like you could do home care, you
Mhm.
can work more in like a medical office, you can do like a 9 to 5 type thing. Like there's so many different routes, especially with nursing, that you can do to try and find like your little passion. Um,
My
but
my
yeah.
favorite part about nursing is just how, infinite the field is.
Mhm,
When you're in school, when you're in clinicals, when you're taking your boards, it's literally all inpatient stuff, other than like your community rotation
mhm,
and some and like 3 questions on your exam, on your board exam. But like, there are a lot of outpatient facilities. There are work from home positions you can do. You can go
mhm.
into informatics. You can, be a coordinator of something, and it's kind of endless. And if you get burnt out in uh, one field or one specialty, you can
Mhm.
go to another one, and that's something people shouldn't always feel stuck in the first place that they're at.
Yeah, and I always tell people that too when they're like unsure of which profession to go into. I'm always like, well, with nursing, like there's so many opportunities. Like there's so much more that you can do. And with respiratory, you're more limited, you know? So like with respiratory, I feel like you kind of have to like respiratory.
Mhm.
But with nursing, like you can just progress and grow and like do so many different things. So that's what's really awesome about the nursing field. So many kudos to you. I don't I could be a nurse. I think I'd be a good nurse because I really like patient care, and you know there's just so many different opportunities that you can go in, but I do feel like the schooling would be hard for me. I feel like I would be overwhelmed. I feel like you guys just have to know so much. I don't know how you do it.
Sometimes I feel like I have to know everything and I don't know everything.
Yeah. I know. I mean, sometimes I feel like I have to know everything too, especially when it's like a vent patient or like something's going wrong, you know? It's like I can only do so much troubleshooting. I can only do so much stuff.
Mhm.
But but yeah, well, thank you so much. This was so fun, and you're so cute. I mean, like,
For having me.
yeah. Okay, you guys can follow AJ's nursing journey on Instagram at AJ the Nurse, and you can
Yeah.
follow me on Instagram or YouTube at Gary RT. And if you're watching this on YouTube, please like this video, subscribe, comment if you want to see more AJ. Maybe we can do some other videos if we get like a lot of nursing questions or something. I could do like a nursing Q&A with you.
Yeah.
Um, but yeah, so comment, like, subscribe, and there's going to be some other healthcare professionals I'm going to be interviewing. So stay tuned. And thank you so much, AJ. I appreciate it.
Thank you so much for having me, Gary.
Yeah.